Hi, I'm Dr. Quinn Fauria from the Foot and Ankle Institute of the West. This is a series that is going to cover the most common problems that I see in my office. The first of this series is going to discuss bunion surgery, in particular the way I do bunion surgery with a minimally invasive technique. So I'm going to talk about the different topics associated with bunions. First of these topics is, what is a bunion? Okay, well, a bunion is a pretty simple thing. On the outside, what people see is a bump on the inside of their foot, and their big toe starts to lean towards the second toe, sometimes even crossing over the second toe. That basically is a bunion. Now, there is a misconception that a bunion is a growth of bone, so that the bump that you see is actually bone that has grown. That is actually not the case. Bunions are formed, or I should say the bump is formed because of a malposition of the joint. If you look at this picture, you can see that there is an angle between the first two bones. Those are called the first and second metatarsals. As that angle increases, the bump on the inside of the foot becomes more noticeably larger. In addition, the big toe drifts to the outside of the foot towards the second toe. Okay, the next topic we're going to talk about is what causes a bunion. It's a really common question that I get from my patients. What's the cause of a bunion? Is it my shoes? Is it the things that I did in my life? And really the answer is it is not something that you did in your life. It is not shoes. It's not activity. Bunions are caused by a musculoskeletal abnormality that exists in a person's foot. That musculoskeletal abnormality is not the same from person to person, meaning there's not one cause. And it's actually a pretty complicated topic. But to make it simple, bunions are caused by imbalance of pull that exists within the foot. This imbalance in pull eventually leads to, as I mentioned before, the big toe drifting towards the second toe, and an increase in the angle between the first and the second bones. Ultimately this happens over time, and the bunion gets bigger and bigger over time. Some people, the bunion gets big really quickly. Sometimes it gets big rather slowly. There are some factors that influence a person's development of a bunion. One factor is pregnancy. Every time a person, or a woman, has a child, there are hormones that are secreted that allow for the pelvis to expand. And those same hormones work throughout the body, allowing for the foot to kind of spread out to a certain degree. So most women after pregnancy will have a foot that's grew about a half size and becomes a little bit more wide. And if they are prone to bunions, their bunion will become bigger typically. Shoes do not cause bunions. High heel shoes do not cause bunions. There really isn't anything wrong with high heel shoes. Of course, a person in a high heel shoe will be more likely to have some sort of discomfort associated with wearing those high heels. And in particular, if they have a bunion, they're more likely to have pain while wearing high heels. But the shoe itself did not cause the deformity. Men who most of the time do not wear high heels, they develop bunions. People who don't wear shoes, live in areas where shoes are not readily available. Those patients can also develop bunions. So it is not really caused by shoes. And so the bottom line is, wear the shoes that you would like to wear. Some of those shoes will be painful, some will not, but the shoes don't have anything to do with whether you develop a bunion or not. Okay, so let's talk about what do we do for bunions. Now, basically speaking, once a person develops a bunion and it becomes appropriate in size, and that comes after an evaluation of your foot, but once a bunion becomes appropriate in size, that's all that is necessary to proceed with correction. Some people think, well, it doesn't hurt, so I don't have to fix it. Well, that's really not the case, and I'll get into why that's the case, but ultimately a bunion should be corrected really when it's appropriate in size. And the reason is because of the secondary changes that happen or that occur, and I'll get into those in a minute. What happens to a person's foot if they do not correct their bunions? Or what are some of the bad things that can happen? Well, bunions are such that they will cause what we call secondary changes. Secondary changes are bad things that happen to your foot just because you have the bunion and you've had it for a long period of time. The first secondary change is arthritis, okay? When I say arthritis, I mean arthritis of the big toe joint. That arthritis will lead to several changes in the big toe joint, but the most important of those changes is damage to the cartilage. So the cartilage in the joint becomes thinner and thinner to the point where eventually you'll have bone on bone. Now, a lot of times I say to a patient, well, you have arthritis, and then the patient will say, well, how can I have arthritis? I don't have any pain. And jokingly I say, I didn't actually say you had pain, I said you had arthritis. And the truth is that arthritis doesn't necessarily hurt just because it's there, until it does. So eventually, if you live long enough and you have arthritis for a long enough period of time, it will become painful, the joint will hurt deep inside. Now, the bad news about the arthritis that occurs in the big toe joint is that it is irreversible. So however much cartilage damage you go into surgery with, you come out with. And that is that, of course, we can correct a person's bunion, we can make their foot look pretty, we can correct the alignment, but the joint itself, the cartilage is damaged however it's damaged. Now the good news about that situation is that the big toe joint, damaged or not, prefers to be in a proper alignment, okay? So it will tend to feel its best when it's properly aligned. And the other good news about properly aligning the joint, which occurs with bunion surgery, is we can stop the progression of the arthritis, or I should say, we slow the progression to a normal rate. I mean, just as people, our joints will become arthritic over time, but when you have a bunion, it starts to become arthritic very, very quickly. So one of the goals of surgery is to stop the progression, or I should say, once again, limit the progression of the arthritis. Okay, so even though I would say to you 98% of my patients have arthritis in their big toe joint while I'm performing their surgery, the vast majority of them don't have any problems or pain with that joint after surgery, which is somewhat surprising. You would think that a person has this damage in their joint, they're going to have some discomfort. But the truth is, usually they don't. The joint feels best when it is properly aligned. Now let's talk about the second secondary change that occurs from having bunions. The second secondary change that occurs from having bunions is something called second metatarsal stress syndrome. Now that is a problem that you would notice in your foot by the second toe will start to change. That second toe will start to contract or bend. Most people know of this as a hammer toe. The toe will start to stick up somewhat. It will move and start to drift towards and even over the big toe. So you end up with, in some cases, a crossing over of the second toe. And you'll have pain in the ball of the foot. Okay, so the second metatarsal stress syndrome causes deviation of the second toe and pain in the ball of the foot. Now these things don't always happen all at the same time. Some people come in and they only have deviation, others come in and they only have pain. But eventually, since this is known to be a progressive deformity, a person will develop pain and deviation. Now once you have pain and deviation, that is a surgical problem, and if you have that currently, we fix that at the same time as we fix the bunion. If you do not have second metatarsal stress syndrome that has pain and deviation, then we treat it in a more conservative fashion. Primarily we have, you wear orthotics, which will reduce the stress that goes into the ball of the foot. And orthotics are inserts that go into your shoes that are made out of a mold of your foot. And we correct the bunion deformity, which is the source of the problem. Okay, next we're going to talk about the two types of surgeries that are done today to correct bunions. There is traditional surgery and there is minimally invasive surgery. Okay, traditional surgery involves making a very large incision, cutting lots of soft tissue, exposing the bone, and working on the bone, making the cuts in the bone, and then using plates and pins and such to hold it stable, and then closing all that up, and the soft tissue up, and then closing your skin. Now the truth is, there really isn't anything truly wrong with that, but there is a better way, and that better way is minimally invasive surgery. Now if you compare what traditional surgery looks like versus minimally invasive surgery, you'll see there's a huge difference. So the incision for minimally invasive surgery is very small, just over 1.5 inches. It involves about 1/4 of the soft tissue cutting, so we do not cut very much of your soft tissue when we perform this surgery. And that leads to just everything being better. Less pain, less disability, less complications. Everything about a surgery that you would like to have is with this surgery, and that is just less problems, okay? In addition, when minimally invasive surgery is performed, it allows for a very easy recovery. So before I get into minimally invasive surgery in greater detail, I'm going to talk about the two locations where bunions are corrected. So bunions can be corrected either in the head, those are called head procedures, or they can be performed at the base, and those are called base procedures. Now there are many different head procedures and there are many different base procedures. They differ in primarily recovery and risk. Head procedures are considered really very easy, especially done with a minimally invasive technique. Base procedures are considered very difficult and have a lot more complications associated with them. Head procedures, you walk right away. Base procedures, you're in a cast, crutches typically, non-weight bearing for 10 to 12 weeks. So a lot of difficulty associated with a base procedure. Now the primary reason a person will have a head procedure versus a base procedure has to do with size of the bunion deformity. Now of course we evaluate an x-ray to determine which surgery is best for them, but size is the primary factor. So once a bunion gets really, quite frankly, too big, we have a difficult time correcting it adequately with a head procedure, and then we have to resort to a base procedure. Now, I have many of my patients who have bunions that are just extremely large, and if anybody were to evaluate those bunions, they would say, okay, this is a person that really needs a base procedure. I have taken many of those patients, and after a long discussion about the details of the surgery, we perform a head procedure with a little tweak. And I'd get into those details with the patient individually. But the tweak allows for a great amount of correction with a easy head procedure. So I can take a person who really needs a base procedure, and we do a head procedure, and it becomes very easy. So those are individual discussions that happen with a person on a case-by-case basis. Okay, so as far as head procedures done with a minimally invasive technique, as I mentioned, we make a very small incision, very little soft tissue cutting. The reason that this surgery can be done in this fashion is because we have special instruments and special equipment that allow us to perform the surgery without seeing everything with our eyes. So we literally have a piece of equipment called the Fauria, which is an x-ray unit that shows us the bones on a screen live. So even though we're not seeing everything, we then can see it, but we use this equipment to perform that function. So that makes the operation safe, and thus allowing us to preserve a lot of the soft tissue and leave it uncut. Soft tissue that's left uncut doesn't hurt. In addition to the lack of pain associated with minimally invasive surgery, in addition, there is a lot of stability that's associated with this surgery. And because of this stability, a patient can walk immediately following the surgery. And that is because the bone cut is stable and the soft tissue is left primarily uncut. And the more of that we can leave uncut and more stable the bone is, the safer it is to actually ambulate without any kind of cast, crutches, or anything like that. So a person literally walks around immediately following surgery with a dressing around their foot and a special shoe called a post-up shoe. So each individual patient, when they're seen, we perform an evaluation of their foot and we take x-rays of their feet. And then we determine the proper procedure for them. And as I mentioned, there are many different head procedures, so we choose the right one for that patient. But basically all head procedures done with a minimally invasive technique have the exact same recovery. So although I cannot get into any great detail about exactly what is needed for every single patient, I can tell you that generally speaking, there are cuts made in the bone in order to realign the joint. As I mentioned, bunions are not a bump of bone that is formed, they're a malalignment of the joint. So in essence, in order to correct them properly, the bone has to be put into the proper position, and that happens by making certain cuts into it. So bunion surgery is done with sedation. So that means an anesthesiologist starts an IV. Once that IV is started, all the medicine goes through the IV and you don't feel any pain or discomfort whatsoever. This type of anesthesia is not the deepest form of anesthesia. So you're not intubated, there's no tube down your throat, you're not paralyzed, and you're breathing on your own. Once the surgery is performed, which takes 30 to 45 minutes, you go to recovery and you're there for about 30 or 45 minutes, and then someone takes you home. 3 or 4 days later, you arrive at the office for your first visit. At that visit, we will start the course of physical therapy. Physical therapy is done in our office following the procedure twice a week, and we do this for about 6 weeks. Now there are exceptions to this rule, and we have specific discussions with each patient depending on their schedule and their availability. But the typical situation is a person comes in twice a week for physical therapy for 6 weeks. The entire time you can stand and walk on your foot. You do have to refrain from high impact activities, and that you have to refrain from that for the entire 6 weeks. So that means no running, jumping, or jogging, but you can stand, you can walk. If you want to exercise your heart, you can utilize an elliptical machine or a stationary bike, and you can do that after about 10 days. Every time you come into the office, we apply physical therapy to your foot and we change your dressing. And then we reapply that special shoe. Once again, it's about the size of a tennis shoe. After 4 weeks of continuous use of the special shoe and the dressing, we then stop the dressings. And we get you into your own personal shoes. Typically speaking, it's a shoe that's like a tennis shoe or a sensible shoe. We then continue to see you for physical therapy for the next 2 weeks. That of course gets you to the 6th week. Once you're to the 6th week, we take a final x-ray, and if everything looks good, we're done. And we allow you to progress back into the shoes that you would like to wear and the activity that you would like to perform. Thanks for watching this video, and I look forward to producing many more videos about the common ailments that are relevant to the foot and ankle.